Hello, Professor and class. I hope all is well. This video is in correspondence to week 2's genetic discussion post. So the prompt says your best friend who is not in a healthcare related job meets you for lunch. They seem upset. They pull out a report received from one of the genetic home testing companies and say, this thing says that I am predisposed to type 2 diabetes. What should I do? I don't eat sugary foods. First and foremost, I'm going to tell my friend to calm down. This is simply telling him that based on his family's genetics, his mom, his dad, his ancestors, it's saying that people in his family has had type 2 diabetes. This is something that runs in his family. It's not saying that he has it, but he is predisposed to having it. So this is a great opportunity for him. The fact that he is eating healthy, he's not eating sugary foods or anything like that. I would tell him to keep up with a healthy diet and not to worry. But most importantly, I would make sure that he goes to the doctor, gets his sugar checked, his A1C. Based on what those are, he continues to maintain the diet that he's been doing. And if he's still concerned, he can keep following up with the doctor just to make sure that everything is okay. But the genetic testing is not a diagnosis. The diagnosis would be if he goes to the doctors and they tell him, oh, he has type 2 diabetes, this is his A1C, then he would have to make some lifestyle changes. But this is not what this is. So first and foremost, genetics just means you are more than likely to get this because it runs in your family, similar to someone who is predisposed to hypertension. Hypertension can run in someone's family. Does not necessarily mean they will get it, but they are at risk to getting it. Same with many other diseases, cholesterol, and many more. So he is at risk to getting it, but it doesn't mean he has it. So do not worry. Go to the doctor, get your sugar checked, and there are other methods. He can even check his sugar at home. There are devices he can buy to check his sugar at home at the right time and follow the proper instructions. And if he goes to the doctors and it's abnormal, he can also follow up with an endocrinologist to further his care. As the endocrinologist has even more of a specialized education in patients who has diabetes, type 1, type 2. Thank you very much for watching. That is the advice that I would give my friend.